This podcast is brought to you by Podcast Nation.
Shopping is hard, right? But there's a better way. Stitch Fix online personal styling makes it easy. I just give my stylist my size, style, and budget preferences. I order boxes when I want and how I want. No subscription required. And she sends just for me pieces. Plus outfit recommendations and styling tips. I keep what I love and send back the rest. It's so easy. Personal styling for everyone. Get started today at stitchfix.com/Spotify. That's stitchfix.com/Spotify.
This episode is brought to you by LifeLock. Not everyone is careful with your personal information, which might explain why there's a victim of identity theft every 5 seconds in the US. Fortunately, there's LifeLock. LifeLock monitors hundreds of millions of data points a second for threats to your identity. If your identity is stolen, a US-based restoration specialist will fix it, guaranteed, or your money back. Save up to 40% your first year by visiting lifelock.com/podcast. Terms apply.
Welcome to Nirvana Sisters, where we discuss all things health and well-being to help you achieve your highest state, your nirvana. Hi, I'm Amy Sherman, a marketing exec with a passion for wellness and beauty.
Hi, I'm Katie Chandler, a former fit model that has a passion for health and fitness.
We are sisters-in-law who share the same love for well-being, ready to sift through all the self-care noise and bring you a splash of what we think is fun. So let's get started. Welcome back to Nirvana Sisters. This is part 2 with Dr. Nazarian. We hope you enjoyed part 1, all about the skin. This episode really focuses on skin conditions, the face, under eye darkness, fillers, Botox, surgery, body sculpting, fat removal, and a game-changing injectable for cellulite. And Katie also has a great product review at the end. So stay tuned for that and hope you enjoy part 2.
Well, I would like to touch on a little bit of a personal note, and that is psoriasis. My husband, my mother, and now my 7-year-old daughter have it. And my 7-year-old has had one large patch on her leg that has now spread to, I don't know, maybe like 30 or 40 spots. And we're trying to kind of wrap our head around it. Like my husband, he's had it his whole life, but it comes and goes. It's pretty light and it's completely stress related. When he's low stress, it's gone. When, otherwise. And my mom's has gotten better. I think she's in what they actually call it psoriasis remission. I think I've read somewhere she doesn't have it anywhere. But my 7-year-old, all of a sudden it's popping up all over the place. And I don't know what to do for her aside from the topical steroid cream that was given to her that I don't really love using. So any thoughts or advice?
Yeah, a lot of thoughts. You're kidding? Tons of thoughts. First of all, your mother and your husband, right? So you have psoriasis, which we know is genetic, on your mom's side, on your side, right? The mommy side. And then we have it on daddy's side. So this poor girl, like obviously she was getting the 2 hits from both sides, right? But it's going to be fine. It's going to be fine. Psoriasis is a skin condition where essentially the skin is just overreacting to we don't know what. So normally the cell cycle is you get your new skin and then it sloughs and, it has this like however many week cycle that takes your skin to renew itself. Fine. For people that have psoriasis, for whatever reason, this normal timeline is like revved up. So you just keep making more and more. So the skin just basically piles up on itself. That's what leads to these thick, red, scaly plaques. But it is an inflammatory condition. We know that it involves inflammatory cytokines in the body. And it can also create some issues in other parts of the body with inflammation. So it's not just a skin condition, right? It can affect the joints. We know that it can affect cardiac, so people can get arthritis, and definitely flares with stress. But the good news is that when I say we've come a long way, I mean we have come a long way when it comes to psoriasis. Every few years, there is a more and more and more targeted therapy for psoriasis. So back in the day, what they used to do is just suppress the immune system because, I'm telling you, this is like basically an overreactive immune system in the skin, right? Too much skin. And so you would suppress that and it would help your psoriasis, but it would also leave you a little bit more vulnerable to infection. That's what you need your immune system to fight. And so what they ended up doing is finding what we call biologics that now target closer and closer and closer the pathway to the inflammatory targets that cause psoriasis. So rather than like blocking the whole immune system, you're blocking it less and less and less, right? More and more targeted, which means way less side effects, much, much safer, easy for people to do. I mean, I have patients on biologics that they only have to give themselves the medication 4 times a year. Every 3 months, little click, boop, done. And that's nice because regardless of how much skin they have affected, which is obviously really upsetting, I don't have to worry so much about their joints, I protected them. Because God forbid you get really psoriatic arthritis, that can be really tough. And so you want to catch those things before they really start to decrease quality of life for patients. Now, steroids, which are like the topical creams, typically we don't really do oral steroids for psoriasis. Topical creams, in some ways, you can think of it as working more locally, right? So you're not affecting the whole immune system, although you do absorb some, but it should be fine, a little bit here and there when they need it. If you find that a patient is becoming sort of not dependent, but like needs it all the time in order to keep their psoriasis in check, then we like to actually do vitamin D analogs. Maybe you've heard of like calcipotriene. Those take a little bit longer to work. Let's just think of it as like vitamin D. And so those take a little bit longer to work. So generally we'll kind of get them started on the steroid cream so they just feel like better faster. And then give the vitamin D creams a little bit more time to work. And then they can do that more long-term. That's a really great regimen if somebody, only has a couple patches, let's say, or it's realistic for them to be able to apply it. We even do topical retinoids if you want to go back to that. Because remember how I told you retinoids help like regulate the cell cycle and get it more normalized, like get rid of like the old skin, help healthy new skin take its place. So actually what retinoids will do for psoriasis will also help regulate the way the cells are behaving and act more normal. So retinoids are a wonderful part of some psoriasis regimens. You can even do ultraviolet therapy or phototherapy, even safer than going outside. Rather than going outside and baking, which a lot of people used to do for their psoriasis because they got better in the sun, and then exposing yourself to all this radiation, which increases your risk of skin cancer. Now we just use specific wavelengths, and that's even safer than being outside for a couple minutes. And so you can do that for your psoriasis and just target the areas that you need. There are so many different ways to treat psoriasis depending on what area of the body it is. But, my advice would be don't get nervous about the medications. I mean, I have family members that are on them. I don't know how I would feel if I had to put my child on medicine. My kids are so young. I mean, I do feel like I'd probably always be nervous about everything. I mean, I'm a doctor. I still get a little nervous when they get vaccines. That tells you what mom brain is and what doctor brain is. I can't shut it off. They're getting vaccines. Of course they're going to get their vaccines, but I don't know why my head just goes, oh, my child's going to be something wrong. Something's going to happen, And with psoriasis, I think it would probably be the same. I'd be a little nervous. I understand that. But if she is getting to the point where it's really impacting how she feels about herself and her life and how she looks, oh my gosh, don't be scared. Don't be scared. Okay. These medications are so safe now. And if you think about it, they're protecting the inside of her body, right? So less cardiac issues, less joint issues. The patients that are on some of these biologics actually have better cardiac health long run, less cardiac events, are just healthier patients because of what these medications can do now. She's young. You want to see how the creams work for a little bit. I get it. You want to have alternatives to steroids, whether you do the vitamin D or you do truly the non-steroidal creams that work similarly but are safe for long-term, maybe names you've heard of like Elidel, Protopic. Those are other medications you can use. There's a lot of options on the menu, and just be open to them. Let them lay out all the risks and benefits on the table. But, for a lot of the stuff that's out there, honest to God, I wouldn't hesitate. I really wouldn't. For myself, my gosh, no problem. For my family members, really, I think it's the right choice.
That's
But,
very
you need
encouraging.
So it sounds really treatable. Like if you're going to have something, at least it's like a treatable thing that she has, not something that's not as
Kim
common.
Kardashian has psoriasis, I mean, come on.
That's
That's
what I
right,
told
she does.
Madeline. Yeah. No, that's very encouraging because these steroid creams are just not working out for her. They're not really helping that much. And she is a little bit more high strung. And I just thought, steroids can seep in, even if it's in little doses. So it's not even helping. So it's good to know that she has other options, and we're going to look into it. So I appreciate that. Thank you.
Of course, reach out if you have more questions. I'm happy to continue talking about it. Okay.
Thanks.
So I have some questions because I'm obsessed with this topic. Puffy eyes, dark circles, ridges, hollowness. Like as you get older and you have that, like I've tried so many different creams, I know there's not a miracle cream, but do you have advice for like the puffy, the darkness, like all of that lovely stuff that starts happening to your eyes?
All right. So under eyes, there's a couple things that happen in the under eyes, right? So as you get older, your skull changes, right? The skull of an 80-year-old is not the skull of a 16-year-old. Like anatomically, they're just different, right? And so one of the things that happens as we get older is the eye sockets hollow out. So you end up getting contour changes, right? Where the eyes are a little bit more sort of sunken in looking as you get older. And then the tear troughs start to cast a shadow. The tear trough is that sort of like ridge underneath your eyes, right? So it tends to cast a shadow as you get older. Some people, they're just like, that's just how they look. They're kind of born like that. That's just the shape of their face naturally. Most people, even if that's not your natural shape, as you get older, you will notice that sort of happening. That's part of it. The other thing that happens as we get older for many, many, many people is that those wonderful cushions of fat that sit around the eyeball tend to kind of move and migrate a little bit as things shift, and also puff out and herniate a little bit as not only as we get older, but as the skin sort of weakens and thins out as well, right? It's a very delicate area, a little bit of pushing, and as the skin weakens, you kind of herniate a little bit. Well, that's where you get like the true puff, that real bag, right? As opposed to what I was talking about before, which is like a contour, hollow, and like shadow being cast, right? Neither one of those issues can be covered with foundation or concealer, whatever it is that people are using these days. You can't cover contour, either a puff or a shadow, with color. It's not going to change anything, right? That's your little test. That's how you know. Versus true pigment, whether it is from rubbing or allergies or whatever else, or just genetic. Some people just have true dark pigment on the skin. So if you like pull the skin down, you'll still see that color. It's just a different shade, right? And then lastly, the area is very thin. So oftentimes if you have thin skin in this area, it's almost like translucent and you can see like purple blood vessels underneath. You're basically, the light's just shining through, right? So you have translucency, you have pigment, you have puffiness, and you have a true shadow from a hollowing. Okay. All those things play into the under eye area. That doesn't even really get into like wrinkles and sagginess, but that we all kind of already know how to identify. All right.
Throw that into the mix.
So all of those things are treated differently. They're not treated the same, right? So you really need to know what's the issue in order to pick the right fix. So for the hollow, we call the tear trough, I do filler. I do a little bit of hyaluronic filler. I've gotten it done. Everyone else has gotten it done. The Kardashians definitely got it done. They've got nothing going on in their tear trough, so they're definitely filled. And that's how you get rid of that shadow. Okay, easy. The bag, that puffiness that's pushing out, that needs to be removed surgically. Not a big deal procedure, but that's the only way to get rid of it. And we do a procedure called a lower blepharoplasty. Fabulous doctors will go in there, take out that little fat pad, close it up, done deal. It's a beautiful procedure. For pigment, you can use topical ingredients that literally lighten and get rid of pigment, right? So licorice root extract, some people use hydroquinone, some people use kojic acid, whatever. There's a lot of different ingredients that will literally break up pigment. And then for that translucency, you have to do things that actually thicken the skin and create more collagen. And whether you want to do it in a way that's topical, like you're using peptides and retinoids and things to help stimulate collagen, or you're doing lasers and microneedling and something else to stimulate collagen, like a procedure or a device, that's the way to do that fix. That also will help with some of the tightening and some of the wrinkles and the crepiness because you're stimulating collagen as well. So just like you're just basically improving the type of skin that you have with that whole last bunch of stuff.
Yeah, that's really interesting and helpful. I've done various versions of many of those things. I've done microneedling a couple times, which I love. I'm not sure if it helps under here, like a little bit. I've done filler once, but I didn't actually love it because I'll tell you what happened. Tell me if this is weird. So I got filler a couple years ago in that area because, again, it was like dark and not as hollow, but just more like that dark look. So I got the filler and I felt like it made the little puffs that I had underneath my eyes like stick out. So I almost felt like it made it look worse, although I didn't look as wrinkly. But the puffiness, like I have a picture of it from like immediately when I got it, it's like it kind of like went out. So I didn't really love it, but I just kind of, it looked fine. It wasn't great. It wasn't bad. It was just sort of like, is what it is, but I didn't like how it sort of puffs it out. And then I guess it took about 1.5 to 2 years to like go out of my system. But lately, so like a month ago, I always had for the last couple months, these like dark lines. And so I asked my dermatologist and she was like, yeah, it's from old filler and it's like casting this like purple, whatever. So I got it drained and there was actually quite a lot still in there. So once I got it drained, it was so interesting because those black lines that were like right here came out. I still have the black under here. I mean, the dark under here, but I don't have that anymore. So it was so interesting. So she was like, you could do filler again. She's like, but it might kind of be the same. So she was telling me about that, like in the future, she was like, you could do a lower bleph, whatever. And then she also suggested doing a fat transfer under the tear trough because she said that might be better than doing filler all the time because it might not like work as well for you. So I always ask the question because I'm like, my husband thinks I'm crazy. He's like, I don't even know what you're talking about. I don't even see it. But like, I see it every time I look in the mirror. Like it's better now that I got it drained, but I still see it. And now I'm like, oh, now that I got it drained, I can actually see more wrinkles. So like, there's never it's like one of, I'm like, it's never like going to even out. It's like, I do one thing, the other thing happens. But anyway, I wasn't sure if like, if you keep doing filler, if it's like bad or if it like stretches out your skin or if it's just better just to do the surgery at some point.
It's really interesting to me how many people ask me about the filler, whether it stretches out your skin. No, it doesn't stretch out your skin. You're not going to damage your skin like that. You're not going to like, the filler's going to go away and you're like, oh, loose and saggy now. Like you stretched a balloon too much. Absolutely not. You are literally replacing what you had. You are stimulating your own collagen formulation and you are trying to just sort of give support to the underlying tissue where it used to have that support. You're trying to look like yourself. That's all you're trying to do. So, but what does happen is you get older, the skin gets so lax, right? Like people think about anti-aging and all they're thinking about sometimes is just like filling, right? But you didn't age by just losing volume. You aged by losing volume and also losing elasticity. Like the skin is more lax and it's less full because you've lost a lot of that structure underneath. So when you anti-age, you're never going to be happy unless you anti-age the same way. If all you did was fill, you'd look like a big balloon, which is, we've seen that, by the way. We've all seen that. I know we've seen it. It's awful when people look overfilled. And then if all you did was tighten, you would look like you had a bad facelift, right? Because that's what they used to do back in the day. They just like tighten it and pull it and sew it back. It's just, they're both completely inappropriate if used alone. The right way to do it is a little bit of filler. For you, tear trough, it's a little bit of a different story, but you know what I mean? Kind of like all over, a little bit in the cheeks, a little bit in the jawline, a little bit in the nasolabial, and then a little bit of tightening, which you can do with different lasers, right? And that's going to help you look like really what you're supposed to look like yourself.
Yeah. And it's funny. She was saying that except to do it with the surgery with fat, but use the fat as a filler and then doing laser. And then she said it will look really natural.
I think so.
I don't know if I'm like ready to do that whole thing. I might just try filler again. But do you find that if people have sort of like a ridge or like a little bit of a fat pocket underneath their eyes, that when they do filler, it like can make it look worse?
So,
or is that just like me being crazy?
You're not being crazy at all, first of all. The patient is never crazy. The patient generally knows their face really, 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 really well, right? So that's really what it comes down to. So when people have both problems, right, meaning you have a ridge and you have a fat pad, the goal is never to put any filler under the fat pad, ever. And you never want any filler like around the fat pad where it can kind of push it out. What you're trying to do is, it's a lot easier if I could show you, but imagine this in your face, in your head. You really just put the filler only into that deep ridge. That's it. And so what you're doing is not touching that pad, but you're trying to get that valley below it to be filled in a little bit so it just masks it and camouflages it better, right? When you have both problems, hollowing out and that puffiness, you can only do filler for a little bit and you will lose the battle eventually and have to get the bleph. Because ultimately that fat pad continues to push out. You can't keep putting tons of filler in there, right? To your point. You only get to, if you have that particular, and this is why you have to always be evaluated to see if you're a good candidate for something or not. But you can only put a little bit of filler in there to a certain point, and then at some point that fat pad gets a little bit too big and you have to say, you know what? I can't keep chasing it now. You got to have that fat pad taken out as it continues to push out. But, I see people with both often. I tell them we can do a little bit, but you got to stay far away from that fat pad, literally just into that little hollow in that valley. And the goal is not to change the fat pad, but to just blend it into the rest of the face nicely. That's what you're trying to do.
And you have to go to someone good, because I think that I've only done it once, and the first person I went to, she was okay. I think I would go to this new person I'm seeing, because I think she would be more like you, like really gentle with it, because I feel like I could see it a little bit. And I felt like maybe she just put too much in, or like didn't do it in the way that's more natural, because I felt like when I smiled, you could see it a little bit, or at least I could.
But a little bit.
But so interesting. Like I could ask you 10,000 questions, but I won't bore everybody else. But I think that's why my doctor was like, at the end of the day, you're going to want to get this. Like, it's not like you need it right this second, but I know it bothers you. If you want to like just nip it in the bud, she's like, just do that. Because that's eventually what people that have that issue do. So
what's so funny though too,
good to know.
Every patient that I see has like this one thing that they just wish they could change about themselves, that I'm going to tell you right now is like a 1 on a scale of 1 to 10, in terms of like really how bad it is. Like I have a patient that I saw just like maybe an hour ago, 2 hours ago, I guess now. And like, she's been chasing her ugly neck, and I put this in quotes because she has like the most beautiful neck, for like at least like 8 years now. Okay. And there's nothing wrong with her neck, but she feels like it's just aging her, and it's saggy, and she feels like it's a fat pad, and it's whatever it is. And I'm telling you, she's a beautiful neck, but we have spent an awful lot of time trying to tweak it and make it how she feels is perfect. So she's not imagining what she's seeing. It's there. I get it. All right, it's a little lax. Okay, I see the wrinkle. All right, I feel a little bit of that fat pad. But really, it's like her thing. You know what I mean? And like, so many
we're our own harshest critic, right?
And it's like one thing that I don't know what it is for you, Katie. I mean, I guess for Amy, it's going to be the eyes, but like everyone has this like thing on their body, that they just hate and obsess over. And, you got to remember, to your point, Amy, we are definitely our own worst critic. There is no way anybody else in your life notices what you're noticing to the degree that you notice it.
Mine's my puffy face.
I get your face is the most beautiful face. It's so ridiculous.
I get the puffy eye, the puffy face deal. It's funny.
God. Katie was so funny the other day. She says to me, when she's traveling, she got a really bad headache, and she's like, "Look at this picture. Doesn't it look like I have a headache?" She's like, "I can see the headache in my face." I was like, don't know what you're talking about, but I get it. So there's like so many more things. The last thing I want to ask you about, because I think you said you do body sculpting stuff.
Yes, that's correct.
I've been reading about something called VelaShape, and like, I don't know if all of these things are all the same. What is like the best one if you want to, there's two things. I think there's like, our listeners, I'm sure, would want to know about these two things. Like one, sort of like the fat removal, and then two, cellulite.
Okay. Boy, fat removal and cellulite. All right, fine. So fat removal can be done surgically, which we know is like liposuction, right? Or it can be done with lasers. And there are different ways to do it with lasers. Some lasers use heat, right? Like radio frequency heat. I actually don't do that. I do freezing. I do cool sculpting, a lot of cool sculpting. And I have to tell you, I love it. Love it. They had a sort of a second generation version that came out not that long ago. And that's when I started doing it for myself, obviously, but also for my patients. And what it does is it, brings the temperature of the fat down to a level where it crystallizes. And we know that fat will crystallize at a different temperature than like muscle or skin or other parts of the body, or different tissues of the body, I should say. And when it's crystallized, which takes generally about 30 to 40 minutes, depending on what area you're doing, You massage out those crystals, and those crystals break. Your body comes and they clear it. It destroys the fat cell, destroys it. And so you have less fat cells there. So you will not be able to accumulate as much fat in that area. And it really does change your shape. So that is your new shape at that weight. You can still gain weight. You can still put on weight, and the weight will distribute however it wants to distribute a little bit more fairly. If you're someone that was treating your belly because you had all this fat deposited in the belly, you're not going to deposit the same way, but you could still gain weight, and you could still gain weight in your belly if you gained enough weight. So I cool sculpted, and then let's say which is a true story, and then I had kids, which is also a true story, and gained weight. And then when you lose the weight, I'll get back to my cool sculpting body when I get back to that same weight. But, I had issues. I didn't want I'm a Middle Eastern, right? So I didn't like my hair shape. I want Kendall Jenner legs. Who doesn't? So I wanted my thighs straighter and all, I didn't want my inner thighs touching, whatever, all the garbage we have in our heads about what we have to look like. But you could do the chin, you could do the arms, you can do a lot of areas. It takes a few weeks to see the improvement. I recommend everyone does it twice to the same area. That to me is considered a true treatment. You do it once, you get a lot of complainers. You do it once in the area, and
and
you have to sit there and show the before and after. See, you look different. See before. See, I hate that. Once you've done it twice, I don't have to show you the before and afters anymore. It's like, we're done. I'm happy. That makes me happy, makes them happy. So I tell everyone twice. You don't have to do it twice because you got a dramatic result after one. Great, good for you. It happens. Fine. But if you're going to do it, you're going to do it the right way. But because I do hear a lot of people that say, "Oh, I don't know. I tried it a couple of years ago. I wasn't sure." I've actually never. I say never. I had like one maybe, but she also gained weight, so I wasn't really sure. But it's a very dependable way to get rid of those fat cells. Cellulite is a little different, and you're asking about it at the right time because we do kind of have a little bit of a game changer that came out a few months ago called QWO. That's actually an injectable that is used to break up those bands that pull down under the skin and create that like wrinkling and orange peel look of cellulite. Mm-hmm. Comes with a little bit of pain, comes with a little bit of bruising, but is super promising,
Really?
Yeah. Now,
is it permanent, or is it something you have to keep doing?
So far, they're seeing some long-term improvement. I mean, you're maintaining these results, I think up to a year out, and they're still looking. So I think it looks really, really promising. I don't do it yet. I'm sort of sitting on the sidelines a little bit, had patients do it, learning about it, getting trained on it. I kind of want to see some people roll out a little bit longer, which is generally how I work with this stuff. But I've had a lot of colleagues that have been using it now for long enough that I'm happy to support that and recommend that. So
that's awesome. I want to look into that because that's another thing I'm always looking for treatments on, because that's why I was researching this Vela shape, which I've seen here and there written up in articles, and it's specifically for cellulite as well. I don't know if it does just cellulite or if it does cellulite and sculpting. I'm not sure. I don't know too much about it, but I'm going to look into this quote too, because that thigh area.
I got to tell you, one of my coworkers, she was really eager to have it done last month, and I wasn't ready to be the one to do it for her yet. And so we had her go to one of my colleagues and have her get it done. And aside from some pretty hefty bruising, which is part of the deal, she's actually looking really good. I tried a bunch of other stuff to get rid of that for her over the past couple years, and I wasn't having much success. And this injection seems to be, and we've been hearing about it for a while now, so I kind of knew it was going to be a little bit of a game changer, but to actually see it in action on people that I know is really exciting.
Yeah, that is exciting.
That's cool. And there's no downtime. I mean, so there's bruising, obviously, but is there downtime or is it painful?
Yeah, it's a little, your muscles feel pretty sore sometimes afterwards. You got a little, like a punch in the leg. And the bruising can be pretty substantial. So sometimes a little bit of swelling that comes along with that. So it's not something I would do during bikini season, but you want to wait until fall,
wintertime activity.
Exactly.
All right. I'm all about it. Okay. So we could literally talk to you forever. So we probably need a part 2. We might be calling you
I think we need to.
But we should probably start getting into our wrap session.
All right. So let's do our wrap session. So, Dr. Nazarian, you've given us so many great tips, but what is your favorite wellness or beauty hack?
Oh, my favorite wellness or beauty hack. Just streamline it. Like just, my hack is just getting everything into what you're already doing now and just tweak it. Like I drink my antioxidant green tea at night because I was going to drink tea anyway. So why don't I drink something that has like tons of antioxidants and makes my life more easy and helps me in the long run, right? Like when I do like I said, my stuff in the morning, it's all infused into that one product. I don't have to think about it. Everything that I do is just a part of my day and it doesn't feel like a chore and it's sort of like hidden in all the other stuff. And so I just think if you can do that with everything, your diet, your skincare products, your walk to work, whatever it is, you just have it streamlined to something where it was all thought out beforehand and it's good for you. Over the course of a lifetime, oh my God, imagine the cumulative effect of something like that. These little tiny changes add up so much at the end of decades and decades and decades. Just remember that it's going to happen. It's science. It's happening. You're not going to be the only body that doesn't respond to this kind of thing. You're going to reap the benefits too. Have patience with it and just trust the science. Just sneak it into your day. And I promise you're going to be so happy later in life.
Yeah, I love that. Streamlining, simplifying, just kind of making it all a little easier, right?
Mm-hmm. Exactly.
Okay, so this is what we call our 5-minute flow. So here's the scenario. You just got out of the shower and dried off. Uber just alerted you. They're 5 minutes away. Like, what is your quick beauty routine what are your holy grails? What do you just put on to get out of the house on time and get into that Uber?
This is in the morning. This is at night.
This could be any time. You choose, but it's like, what's that quick thing that you have to you got 5 minutes. You got to just throw it on and go. Obviously we know sunscreen. What else?
No,
could be body, could be face. Could be hair,
it's my eyelash curler.
There you go.
Oh,
nice.
That's a good one.
That's it. That is, I put on a fancy schmancy watch. I put on, I take my little eyelash curler and I clamp it and then I'm out the door. I don't do a lot of bling. I don't do a lot of anything. I just I work so hard on my face all the time.
Your skin's perfect.
Right. Well, perfect, whatever. It is what it is. Thank you. But the point is I don't have to think about it on the daily because I already put in the time. So when I jump out of that shower, a little Aquaphor maybe to the lips, a little clamp on my lashes, a little watch on my wrist, I'm out the door.
Nice. Yeah.
Love it.
We love the Aquaphor on the lips trick too.
Yeah. And then how do you maintain your daily nirvana? Because you are a busy doctor. You've got 3 young children. You're a wife. I mean, how do you kind of keep that daily peace?
Well,
so anything you do?
To be honest with you, it changes depending on my stage in life. I have realized what I could have done a few years ago with maybe even 1 kid, maybe what I could have done with even 2 kids. I can't do with 3. And a husband, right? Like just what I did as a single girl to really get my calm, whether it was go for a run or do whatever. Sometimes it just can't happen now. The only thing that happens daily now with 3 kids is a shower, right? Let me tell you, my shower, even though it's not very long, is like my nirvana. It is my happy place. I find water always has the ability to just calm and heal and recenter. And so I take this shower, I enjoy the water coming, onto my face, onto my body. And I have my little products there that I use where I feel like I'm just it doesn't feel like a chore. Maybe showering is a chore for some people. It doesn't ever feel like a chore to me. I just enjoy that feeling of just starting fresh. And that's it. That's today, now, Rachel Nazarian now in life at this age. That is my nirvana. I sort of hope in a few years that maybe it changes and it's something else, like getting to sit and read a book, or lighting a candle, or doing my sage. But right now, it's those minutes alone in the shower that I get.
Well, that's very accessible. So that's
it's good. It actually triggers your parasympathetic nervous system. A nice long peaceful shower. I mean, it's a very restful, rejuvenating thing. I do that too, actually. Come to think of it. Yeah.
It's either going to be that or it's going to be me attacking myself with a laser and needles, which happens in the office. But, and I look and I sound masochistic, so I'm going to go with the shower.
Nice.
I love it. So we've kept you like forever, but with just two quick things before we wrap up. So Katie, we typically do like a quick what we're loving product review at the end of the episode. So Katie has something to share with us, and then I have a closing mantra.
Yeah, so I am excited.
Katie, what do you have? I'm very excited.
The product review, I'm doing it this time. Usually Amy does it, but I found these two new products that I'm obsessed with. It's the Charlotte Tilbury Supermodel Eyebrow Kit. I have like very, very sparse eyebrows and I always have to fill them in. And I've always had a really hard time finding the right product to do it with, but these are amazing. The reason why I love it, the tip of the pencil is like angled and very thin, and it's made from Canova wax. I think I'm saying that right. So it comes on like very, very feather fine. It literally looks like you're putting like another eyebrow hair in. I mean, it's really, it's just the way that it goes in is so smooth. This is called the Brow Lift Pencil. It's $25. It comes in 8 shades, smudge proof, humidity proof. It's great. And then I finish it with the Brow Fix Sculpting Gel. And this is $23. And this is a 24-hour lasting clear brow gel that will condition your eyebrows. It sets it. And it's invisible. It doesn't like flake or anything. When I'm like, not necessarily going out or just kind of want a casual look, I'll go without this. But if I really wanted to set and kind of like pop, I add in the Brow Fix. So I am absolutely obsessed with it. It's a really, really good one. The whole like thick, very full eyebrow that all the supermodels have right now. Like
I love it.
I love that.
This will give it to you.
So you can, so I bought that. I haven't used it yet because I wanted to hear Katie talk about it. So you just like kind of go against your eyebrow and it kind of just fills it in and
you just do just roll it up the littlest bit and then you just kind of go like where you're sparse and then I noticed that actually if I do it with my left hand on my right eyebrow, it doesn't look right. I have to like switch hands and because you have to go in the direction of the brow. That's the trick. So, and then it has this little.
Well, your brows look amazing.
Thanks.
So,
a little brush on the end where you can.
I'm gonna try that.
Go for it. It's a good one.
Ooh,
so, what's your mantra, Amy? We need a good one. You have one for us?
Yeah. So to close out, and before we close out, just want to say thank you so much, Dr. Nazarian, for giving us so much time. We definitely want to have you back because we have like a million more questions. But we love all the information you gave us. I think it'll be so helpful to our listeners, and it was definitely helpful for us. So we really appreciate your time and your energy. Your whole vibe.
Thank you. So you guys are so sweet. It's been such a joy to be on and so much fun talking about everything. And I love to come back. I think that's the one thing about dermatology. It's a little bit of a black hole. There's always something that you want to talk about. There's always more to know. So thank you so much for having me. It's been a blast.
Oh, thank you.
Great. So I'm going to end with something because we've been talking about, our skin and all the things that we want to fix. And at the end of the day, here's a mantra that I think I need to tell myself, and we probably all do, which is become so confident in who you are that no one's opinion, rejection, or behavior can rock you. So it's like, don't listen to what anybody else is saying. And even sometimes what you're saying to yourself, because I was thinking about it, I'm complaining about this and that. But at the end of the day, if you're confident and you like feel good in your skin, nothing else matters. So I think it's really important to remind ourselves and our audience that at the end of the day, you just got to feel good. You got to feel good about yourself.
That's so true. Thank you for that reminder, Amy.
Thanks for listening to Nirvana Sisters. For more information on this episode, check out the show notes, please subscribe, and leave us a review. Also, find us on Instagram at Nirvana Sisters. If you loved what you just listened to or know someone that would, please share it and tag us. Tune in next week for a fresh new episode of Nirvana Sisters. We'll continue to watch out for all things wellness so you don't have to. Bye.